Namaste. Myself Dr. Santhakumari, Chief Physician of Matha Ayurveda Hospitals, Thiruvananthapuram. Today, I am facing you to talk something about retinitis pigmentosa. It is a very threatening eye disease. Threatening because a successful line of treatment is still out of reach. In spite of continuous research works all over the world, and in spite of all the modern technologies, all the techniques, a successful result is only a dream among the ophthalmologists. So it becomes a very serious or a very dangerous disease till the date. Now, what is retinitis pigmentosa? Simply we can say it is a degenerative disease of retina, especially the pigmentary layer of the retina. Then two words are there to be noted. One is retina and second is pigments. Retina is the most sensitive part of the eye, lying posteriorly inside the eyeball, and it is responsible for the sharp and perfect vision. The light rays coming reflected from the object externally and passing through the eyeball, it focuses on this layer, retina, and then starts the biological reactions. That is the first step of physiology of vision. So any defect or any pathology of this layer is capable of developing visual defects. Different types of visual problems may be developed if there is any disease of this particular part, that is retina. Then comes the second term, pigments. Retina is made up of 10 layers. Out of these 10 layers, one layer is known as pigmentary layer. And there are two types of pigments in this layer. One is rods and the other is cones. Rods is responsible for dim vision. That means in dim light. It is also known as photopic vision. And these pigments are scattered or distributed on the layer of retina and peripherally. And while coming to center part, it becomes less in number, and again less will come into the center region. And the second pigment is cones, and it is responsible for day vision, otherwise known as photopic vision. That means in the light vision, when there is sunlight or bright light. And these pigments are distributed on retina more in the central region, and while coming to the peripheral, it becomes less in number. In short, rods are packed peripherally more and cones are packed thickly in the central area. And this retinitis pigmentosa affects these pigments more seriously, and it is getting degenerated. So both this scotopic vision and photopic vision are affected. So itself we can say the one of the main symptom will be this problem in the night vision, known as night blindness. And the second thing, when it goes serious, other pigment, that is cones, also will be affected, then the day vision also will be affected. In the day vision, another more important factor is sharp vision, or otherwise known as a detailed vision. So in dim vision or scotopic vision, we will be having a general idea of the object only. Very minute details or very perfect details will be only in the day vision. So the color of the objects and the minute details, that is the margin or sharpness, etc., will be possible only in photopic vision. So The second symptom of retinitis pigmentosa comes as this color blindness because of the degeneration of cones. Then the third main symptom is field defects. Field defects means there is a visual field for sharp vision. That means this much area should be seen perfectly to a person. For example, we need not see something behind our eyes. Backside it is not in our visual field. Laterally also there is a limit. Superiorly also there is a limit. So within the visual field, the object should be seen perfect. That field will be generally reduced or constricted in this particular disease. That is because the pigment, especially the rods, are packed on the peripherally, and when it is degenerated, that area is already gone. So visual field is anyway it will be lost. So in a retinitis pigmentosa patient, these three symptoms are more important: night blindness, then color blindness, then field defect. And the field will be reduced gradually, and finally it may be up to the level of a tunnel vision, only just like viewing through a tube. That much constriction may be developed. And finally what happens? Total blindness is the result. So retinitis pigmentosa is a disease which, if not treated by an experienced hand in time, in the correct time, it is capable of leading to blindness. It is already proved that it is a genetic disorder. So, while coming to the point of treatment, we have to consider all these points. It is a genetic disease. So, a total cure is out of the science at present. Then what is the aim of treatment? It can be maintained, it can be managed, or it is treatable. That means there are so many diseases which is not curable, but it is manageable. Even diabetes or hypertension is not curable totally. But we can manage it with the medicine or with the food control, with other restrictions. We can manage it and can have a good life. Like that, we can manage retinitis pigmentosa also by protecting our vision from being blind. But the thing is that it should be handled by an expert hand in time with appropriate medicines. So, what is a line of treatment? It is not a simple medicine from start to the end, because it is a long-standing disease. It may start from the childhood and being blind by the age of 40 or 50. There are a wide range of complaints are there, wide range of all things are having very big wide range. So before starting the treatment, we have to take some precautionary methods and some preparatory methods also. The treatment is conducted in 2 steps. The first step is a preparatory method and preparation of the patient, and it includes also a generalized treatment procedures for the patient. Because the patient may be of different age group, or the clinical stage also may be different. So a preparation of the patient is very, very important. We know this is a genetic condition, so it's of the treatment becomes a little tougher. The preparation is not a simple thing. It is actually a Sodhana therapy. In Ayurveda, we will say Sodhana means to eliminate whatever unwanted, whatever toxins, whatever pathogens in the body to be discarded. This is known as Sodhana. So this Sodhana therapy is performed by panchakarmas. The term panchakarma may be familiar to many of the people. So panchakarma is a method to eliminate the unwanted toxins and other deposits from the body. Here that is necessary. So in the first step of the treatment, we will be doing Sodhana therapy, doing panchakarmas wherever necessary. And if anything specially needed for that particular patient, that also is considered. In the second step, the treatment be focused on the eye alone. That is to rejuvenate or to revive the ophthalmic tissues as far as possible. The main aim will be to arrest the further progress of the disease and to develop or to boost up the existing cells. The functional capacity of the remaining cells, the remaining tissues will be improved. That is the second step. For that, very specific, highly effective ocular therapeutics and ophthalmic medications are necessary. That also may vary from patient to patient according to the clinical stage of the disease. And different types of procedures such as Netra Sega, Sodhana, Netra Tarpan, Netra Pudapaga, etc. are performed to achieve this aim. So the medicines also plays a very important role because since it is a genetic disease, continuous intake of medicine also will be necessary. So that also will be instructed to the patient. And very selective medicines, which is having the properties of Rasayana. Rasayana is a very peculiar term in Ayurveda, which maintains the balance of all the tissues, all the Sapta Dhadus in Ayurveda. The term Dhadu is there, Rasa, Rakta, Mamsa, etc. So to maintain the balance, to maintain the actual ratio of these factors, that is known the drugs or ingredients which is capable of maintaining the balance of these things are known as Rasayana. So Rasayana therapy should be introduced in the second step. And the Rasayana properties also should be focused on the properties of eye. That means the drugs which is having the Rasayana properties or rejuvenating properties and which will be acting very clearly in the ophthalmic tissues. That type of ingredients, that type of medicine should be selected for the treatment of RP. Otherwise, there will be no result. So, after a Sodhana therapy or a eliminating therapy, if you are performing this Rasayana therapy, focusing on the eye, we will get a very good result for RP. And then the vision of this particular patient can be protected to a great extent. And in many cases, in my experience, it can protect him from being blind. It doesn't mean that the disease is totally cured. It is not like that. He can live his life without being blind. So that is the great achievement by the Ayurvedic methods, Ayurvedic treatment procedures. Thank you. I am Dr. Santhakumari. I share these things for you and is the chief physician of Matha Ayurveda Eye Hospitals.